I remember Marie Michnick, who was the director at the time when I became a fellow, said, at the end of this fellowship, you will be different. And she says, you won't look at the news the same way. You won't read the newspaper the same way. You won't read articles the same way, because you'll have a different lens. You'll have a health policy expert lens that you will now bring to everything that you touch. And she was absolutely right.
I tell the folks, your career, this is a dividing point in your career. Everything that you've done up to this time, when you look back on it 20 years from now, everything you do after this time is going to be different. It's going to be influenced by this year. And they come out of the program. I think most of them go back to their sponsoring institutions, but they are perceived differently in that institution, and they perceive things differently. And that becomes the stepping off point for what they do in the rest of their career.
I used to joke with the other fellows in the first part of the year that I was waiting for the transformation, because everybody said it's transformative. And I thought, well, when is that going to happen? But it is a transformative year. I think it really changed the way that I think about the role of physicians and other people who work in medicine, what our role is in policy, and how policy affects what we do every day. It also changed what I think about what I can do. If I stay in clinical leadership, then I do want to be involved in policy from a research and analysis, and hopefully a kind of a real world effect from policy work. And I would like to be able to leave this working policy shop, that hopefully this isn't something that just happens for a time and then goes away, that really becomes a shift in how my institution approaches health policy. And these are not things that I would have imagined doing before.
The impact this program has had on my career is really immeasurable. I don't think I would be where I am now had I not had this program. The understanding of policy at federal and state levels, and just the politicking and how it works, and how to move conversations, and how to build coalitions, and how to engage the sectors, and knowing the timing of when to do this. I started out as a lecturer at the University of Washington in Seattle, and then I moved into full-time faculty position at our Bothell campus, and then I was appointed co-director of our K-12 behavioral health program, for which I co-directed that program and got a $750,000 federal earmark from Senator Patty Murray to support that program, in addition to getting funds from our state legislature. And then I got promoted and appointed to be the director of nursing. And I don't think that's a coincidence. I think this program prepared me to do what needed to be done to be in a space for people to notice those skills, value those skills, and put me in a position where they could be best used. And I think that's what I carry with me, and why I have such gratitude for this incredible program that helps me to help others in a more effective way. The fellowship it's fuel for your future. It's fuel, it's a layer that builds on what you can do in the future.
I think the individuals who finish this program, they have the knowledge and the skills, but I think even more confidence, if you will, to take on more progressive leadership roles. We've got fellows who are thinking about running for office because of this experience. We have fellows who have gone on to assume very influential leadership roles in the policy arena, because now that they've got a taste of this from the fellowship program, you can't help but come out wanting to do more, wanting to build on this experience. And because we're all over the country, our impact is felt in all kinds of arenas. It's in the halls of government, local, state, and federal.